Hello student, in this video we will discuss about progestin and anti-estrogen. Progestin is a female sex hormone. It is secreted by corpus luteum in the second half of menstrual cycle and by placenta during the pregnancy. So what is the mechanism of action of progestin? Progestin bind to its progesterone receptor. Progesterone receptor has limited distribution in the body. They are mainly present in the female genital tract, breast, CNS and pituitary glands. Progesterone will bind to the progesterone receptor, which will it will go undergo dimerization, and there will be binding of it to the progesterone response element. This PRE will regulate the transcription and in turn regulate the protein synthesis. So what are the action of progesterone? Progesterone. Action of progesterone on uterus. It helps in the maintenance of pregnancy as it inhibits the tubal motility and uterine contraction. So it helps in the maintenance of pregnancy, and it also responsible for the secretory phase. Next, action on the cervical mucus. It makes the cervical mucus thick, more viscous and acidic. So cervical mucus will be hostile for sperm penetration, means there will be difficulty in the penetration of sperm. Next, on breast, it helps in the proliferation of acini in the mammary gland. Next, on the effect of CNS. Progesterone has effect on CNS as the progesterone receptor we discussed, it is present in CNS. So it has sedative effect during the pregnancy and also responsible for the mood swings. It also increases the temperature of the body. There will be slight increase in the temperature of female body. Next, it also increases the respiration. In metabolism, long-term action of progestin or use of progestin may decrease in the glucose tolerance. It also increase the level of LDL and decrease the level of HDL. They stimulate the lipoprotein lipase activity and favor the fat deposition. Progestin also produces the sodium and water retention. Also, they inhibit the synthesis of estrogen receptor. As progestin has also negative feedback action on hypothalamus and anterior pituitary. So what are the preparation of progestin available? Progestin preparations are either natural preparations and synthetic preparation. Natural preparation is progesterone. It is not effective orally, so it is given as intramuscular injection, and it is an oily suspension. So as it is given by injection, so it is painful. It and also cause the lipodystrophy at the site of injection. Next, the synthetic preparations can be given orally. They are again divided into the progesterone derivative and testosterone derivative. The preparations of progesterone derivative are medroxyprogesterone acetate, hydroxyprogesterone caproate, magistral acetate, and a newer compound is normogestrol acetate. The testosterone derivative are also divided on their chemical structure into the estrine and gonanes. Estrine preparations are norethindrone and linestrol, and gonane preparations are levonorgestrel, desogestrel, norgestimate, and gestodone. These gonanes are more potent and they have strong anti-ovulatory action. So what are the uses of progesterone? They are also used in contraception, as they suppress the ovulation because they have negative feedback mechanism on hypothalamus and anterior pituitary. They are also used in the treatment of dysfunctional uterine bleeding. Dysfunctional uterine bleeding occurs due to the unovular cycle and overgrowth of the endometrium. So the oral progestin, a high initial dose is used to arrest the bleeding, after which maintenance dose is given for 20 days. The withdrawal bleeding occurs in 2 to 5 days after stoppage of the therapy, and the cyclic treatment can be continued for 3 to 6 months. They also used in the treatment of endometriosis as they inhibit the proliferation of endometrium. Next, they are also used in the treatment of premenstrual syndrome. In premenstrual syndrome, there is mood swing, tightness of the breast, so they are used in the treatment of premenstrual syndrome. They are also used in the treatment of threatened abortion because progestin help in the maintenance of pregnancy and causes the decreases the uterine contraction. So they are used in the treatment of threatened abortion. Next, as they help in the inhibiting the proliferation of endometrium, so they are used in the endometrial carcinoma treatment. They are also used in the postponement of menstrual cycle. Either progestin or combined OCP pill are started 3 days before the expected period and continued till required time as needed. The withdrawal bleeding occur within the 72 hours after stoppage of the drug. They are also a component of the hormonal replacement therapy. So what are the side effects caused by progesterone? They causes acne, they causes fluid retention, also in weight gain, and they will lead to the irregular menstrual cycle, hirsutism, and increased blood glucose, as the causes the glucose tolerance, and there will be increased risk of breast cancer as they proliferate the breast cells and SNI in mammary gland. So next is antiprogestin. What are antiprogestin? They are the competitive antagonist of progesterone. They also have anti-glucocorticoid activity and anti-androgen activity. Two drugs are preparation antiprogesterone, which shows the antiprogesterone activity. One is mifepristone and second one is ulipristal. Mifepristone, action of mifepristone. In follicular phases, they delay and cause the failure of ovulation, and during the luteal phase, they prevent the secretory changes of the endometrium. On later stages, they block the progesterone support to the endometrium and stimulate the uterine contraction. If the implantation has occurred, they block the decidualization and the conceptor will be dislodged. Means they are used for the abortion cases. Pharmacokinetic of mifepristone. They are active orally. Bioavailability is 25%. It is metabolized in liver by the CYP3A4 enzyme and excreted in the bile. The T half of mifepristone is 20 to 36 hours. They interact with the CYP3A4 inhibitors, enzyme inhibitors, and inducers. So, what are the uses of mifepristone? Mifepristone is used in the termination of pregnancy, as they block the progesterone support to the endometrium. They also help in the cervical ripening, and for the post-coital contraception they are also used because they cause the uterine contraction and also block the progesterone support. Next, they are useful for the induction of labor, as they causes the uterine contraction, and in the as they have anti-glucocorticoid activity, so they are used in the treatment of Cushing syndrome. What are the side effects caused by mifepristone? The main side effects caused by mifepristone are headache, nausea, vomiting, epigastric pain, and menstrual delay. Next agent which has antiprogesteronic activity is ulipristal. It is also known as SPERM, that is selective progesterone receptor modulator. It is used for emergency contraception. It also effective during the 72 to 120 hours of unprotected intercourse. Mifepristone is used as a postcoital contraception if it is used within 72 hours, but ulipristal is used after 72 hours to up to 120 hours of the unprotected intercourse. It inhibits the LH surge and it also ruptures the follicles, so there will be no fertilization process occur. So if you like the video, please share and subscribe. Thank you.